Alrighty. Well, hello everybody to our webinar on utilizing your PIT data for your LHC and aligning the data with your LHC's goals. My name is Ava Paredes. I am the data coordinator here at Texas Homeless Network. I'm here joined by some of my colleagues. If y'all want to introduce yourselves.
Hi, everyone. My name is Jim Ward. I'm the Director of Planning here at Texas Homeless Network.
Hi everyone, I'm Jen Beardsley, the actual Jen Beardsley, and I'm the local homeless coalition coordinator at Texas Homeless Network.
Hey everybody, I'm Craig Blaze-Fierro. I'm your COC programs coordinator. I will be your fly on the wall helping tech in the back end.
Alrighty. Thank you all for being here, of course. So let's just jump right into it. Let's start off with our agenda for today. We're going to do a quick brief overview of the PIT count. I know I see some people in here who already are pretty familiar, so we'll keep it pretty short. And then we'll talk about why we want to use PIT data when applying for funding. We're going to talk a little bit about the 2023 PIT results themselves. Talk a little bit about the housing inventory count data as well. Some comparisons between those data that we can use to find gaps in services, as well as some guiding principles and implications. And then we'll have some time to wrap up at the end and ask questions if we need it and give out some important links and our contact information. Alrighty, so all that being said, what is the PIT count? I know many of you are already familiar with it, but I have just a quick brief overview, the who, what, when, where, and why of the point in time count. The who is obviously individuals and families residing in unsheltered locations, such as cars, parks, streets, sidewalks, and other places not meant for human habitation, as well as individuals and families residing in sheltered locations, such as emergency shelters and transitional housing. The what is the PIT count, of course, which aims to provide a snapshot of the individuals and families experiencing homelessness in a geographical area over the course of one night. The when is the last 10 nights of January. This is when HUD mandates us to have our PIT count in the last 10 nights of January. The where is, of course, the Texas Balance of State COC. You can see on the screen, we have a screenshot from our mobile app that shows survey results from across our geography. You can see our geography there outlined in blue. And of course, the why, for awareness in order to advocate to our local governments to understand the extent of homelessness by determining the number of people experiencing homelessness within our geography. We want to understand, we want to, of course, what we're going to be talking about in this webinar, using our data to secure funding for to advocate for private or local government funds, and as well as to determine eligibility for COC, ESG, and other federal funding opportunities. And finally, for engagement, as the PIT count allows us to develop personal relationships with those experiencing homelessness and create a shared sense of responsibility across a wide variety of stakeholders. Alrighty, so with that being said, why should we utilize the PIT data when trying to align the interests of LHCs? Well, the PIT data, although, the methodology is not perfect, it is a very reliable source of information on homelessness because the PIT count occurs at the same time throughout the country. It provides a snapshot of homelessness not only within our communities, but across the state and across our country. And because of this unilateral participation from several communities throughout the geography of the Texas Balance of State COC, we're able to use this concerted effort, this opportunity to gather a data set of numerous demographics that we're going to go through a little bit later. So we can ultimately use this data to identify populations that are needing more attention, as well as gauge the needs of our communities. The point in time count also happens at the same time as the housing inventory count as well. And we'll go into a little bit more detail later in the presentation. But in short, if you look at both the point in time count data and the housing inventory count data, you can see the extent of homelessness within your community and also identify your capacity to respond to it. All right, so let's go through some quick data highlights real quick from our most recent count in 2023. We had our PIT count in the Texas Balance of State COC on January 26, 2023. That was a Thursday. And in that point in time counts, we counted 9,065 individuals experiencing homelessness. So 9,065 people experiencing homelessness. 57% of those folks were unsheltered, and then 43% of those folks were sheltered. So here's some of the demographics that we wanted to break down for y'all. And you can also look at some of the, you can email me at data@chn.org, and I can give you individualized reports for the data within your geographies, so you can identify some of these demographics that might be important to you and your community. So we counted 7,237 adults over the age of 25. We counted 589 youth between the ages of 18 to 24, 1,239 children under the age of 17. We also identified 1,187 adults that reported that they are currently fleeing domestic violence. We had 584 participants that reported that they were a veteran. 21% of individuals reported that they are chronically homeless. And then we had some more subpopulations, such as 15% of people responding that they had a substance abuse disorder, and 23% of people responded to having a serious mental illness. We have a gender breakdown at the very bottom, as well as the racial disparity that we notice year over year, which is basically 23% of people experiencing homelessness in the BOS are Black or African American, despite only being 13% of Texas's total population, according to the US Census. All right. So here is a quick comparison year over year for some of the PIT data in comparing this data to 2022. So this year, there was an overall 46% increase in unsheltered homelessness and an 11% increase in sheltered homelessness. So while these increases may seem significant, there are a few considerations to keep in mind when comparing these data sets. And we also want to keep this in mind when we're comparing year over year data for our individualized regions and LHCs. Also when we're in the process of applying to funding. So again, while these increases may seem significant, here's some of the considerations that I would just want y'all to keep in mind when doing year over year analyses. So our count in 2023 occurred on a single night, as opposed to being split into 2 dates like in 2022. We also had increased volunteer recruitment, advanced planning, comprehensive training, and hotspot mapping in advance of the count. And the weather was also much more clear, increasing the visibility of our unhoused neighbors and enabling volunteers and communities to conduct more comprehensive counts within their region. And COVID also played a significantly smaller role leading up to the count. And all these factors led to a higher amount of engagement overall across our geography. So again, when making comparisons year over year for your data, keep some of these factors in mind when applying for funding. All right, so now we're going to shift into talking a little bit about housing inventory count data. Very, very briefly. So the reason I think it's important to have to talk about both these counts in this particular presentation is because they happen simultaneously and they're analyzed together. So for those that aren't familiar, the housing inventory count is the annual count of beds and units designated to serve those experiencing homelessness. So it includes both the emergency shelter and transitional housing projects that we count in the point in time count, but it also includes rapid rehousing beds and permanent supportive housing beds. So a pretty simple way to think about these two counts, the point in time and the housing inventory, is that the point in time measures people, whereas the housing inventory count measures housing. And when you look at them both together, it demonstrates the scope of homelessness in our areas, as well as our capacity to respond to the homelessness crisis. So here's just like a pretty simple Venn diagram to explain the similarities and differences between the sheltered pit and HIC. I won't go into like super high detail through each bullet point, but a quick summary is basically that the PIT requires individual surveys of each client residing in an emergency shelter or transitional housing program, which takes about 25 to 40 minutes to complete, whereas the HIC is only one form for each housing project your organization has, which amounts to about 10 to 20 minutes total. It is important to note that they're both required by HUD. They happen at the same time, whereas the PIT is driven by our local PIT leads with support from THN. The HIC is driven by us with support from our local leads. And here is some of the not the point in time count, the housing inventory count data for 2023. So it's broken down into 3 sections when we report it to the Department of Housing and Urban Development. We have households with children, we have households without children, and households with only children. So those households with children include at least 1 adult and 1 child. Households without children are households that just have adults, no children under the age of 18. And then households with only children, which include people that are all under the age of 18. And so you can see that we have these, the housing inventory broken down into these pie charts, represented by the different colors. We have other permanent housing in purple, emergency shelter in green. We have transitional housing in red. We have rapid rehousing in orange, and then permanent supportive housing in blue. So if y'all are interested in seeing any reports of the housing inventory count for your particular region, we have this data on our website, but I can also send you an individualized report if you would like for your particular LHC. Just again, email me at data@thn.org and I can get that data to you. All right, so here's a comparison of the 2023 PIT data to the 2023 housing inventory count data. So this is what we would call a gaps analysis. So this kind of gaps analysis are an excellent way to find areas that you might be needing funding for. You can see that while we have a surplus in veteran beds, we also have a significant deficit in beds for general population single adults without children. So when applying for funding, doing these simple gaps analysis can be crucial when trying to determine the scope and scale of the need within your community, within your LHC. So an important goal to keep in mind is to have your funding needs align with the interests and priorities of your LHC. And we want to make sure that we're using the PIT data to drive this conversation. We want everybody to be on the same page in regards to homelessness within our communities and within our LHCs, and trying to align those funding needs with the data, what the data is telling us. So to talk a little bit more about that, I'm going to pass it off to our Director of Planning who introduced himself earlier, Jim Ward. Go ahead and take it away.
Yep. Hey, everyone. Thank you, Ava. And excuse me, I don't know if it's allergies or what, but my throat's a little scratchy, so forgive me if I go on mute for a second, and I'll be right back. But I think, you know, what Ava's talking about is right on the money, right? Like when we host funding applications, which folks on this call may or may not know, you know, THN has the opportunity to host what we call the Continuum of Care Notice of Funding Opportunity. That is HUD's single largest investment in addressing homelessness on an annual basis. And so we're tasked with evaluating project applicants that are proposing to provide housing and services to people experiencing homelessness. And so one of the things that we have to evaluate is what is the need that you are trying to solve in your community? So, you know, HUD would expect that requests are based on verifiable need in a community. And so a really good way to establish the need for the type of project that you're proposing is using your PIT and HIC data in very much the similar way that Ava just demonstrated on the previous slide, right? Like we want to know what is the problem that you're trying to solve and the extent of the problem that you're trying to solve. Talking specifically about the COC program NOFO, and I need to be somewhat careful in terms of what I say and what questions I answer on this call, because that funding competition is imminent, and we don't want to, give the appearance of any type of a conflict of interest, favoring the people that are on this call versus other folks. But, we're going to ask you narrative questions if you or someone from your community applies for these funds about their use of data sources to establish the need for the project. And really what we're looking for here is evidence that the project is, again, based on some type of quantifiable need in the community. We would, again, similarly, I suppose not again, encourage folks to consider targeting your projects to either the general population of people experiencing homelessness or specific subpopulations that are reflected in your point in time count and your housing inventory count. So an example of that would be, if you have identified 0 transition age youth in your point in time count, but then are applying for a 50-unit transition age youth serving rapid rehousing project, we would have questions about that. Doesn't necessarily mean that we wouldn't recommend the project, but it certainly is a factor in the evaluation process. So, I think that's a really specific example of when a funder is looking at your use of data to evaluate or to demonstrate need. One of the other things, and I know this is an LHC call, right? So as part of that COC program competition, we do ask applicants if they have the support of the local homeless coalition, right? So part of your evaluation in terms of whether or not your project or your community supports a local application might be something similar, right? Might be asking questions of the applicants in your community. Well, how did you determine the need for that project? Or tell me more about why you selected this over that. And that really comes with an understanding and familiarity with the data itself. Ava, do you have anything that you would add to that? Or Jen, I know you're on the call as well. Anything that anyone would add to those points?
I don't have anything to add. I think you're right on the money with that.
Okay. The next slide is a little bit of a tangent. If you know me, you know that I like to go off on tangents. So someone can move us to the next slide. And I think we'll have plenty of time for questions and answers. But this really kind of plays into like your LHC's local goals. So specifically strategic planning, and within your community's strategic plan, like what part of that plan or action plan is focused on the point in time count growth and enhancement? Because using that example that I gave earlier about a transition age youth serving project and no youth identified in the point in time count, right? But anecdotally in your community that there are youth that would fit the description and would be eligible for the project. How are you going to solve for that problem? So that's kind of a two-part thing, right? Like, how do you make sure that your local point in time count is accurately reflecting the need in your community? And I think one of the ways that we would encourage you to develop the point in time count locally is through inclusion in a local strategic plan and reflected in your action plan document. So in like an annual action plan, sometimes we'll see LHCs do a 3-year strategic plan, and then there will be annual updates to that strategic plan. Our COC, as an example, has a 3-year strategic plan. We're in year 2 of that right now, but there are specific actions focused on how we grow and enhance the point in time count throughout the process. And you can do that a variety of different ways. You can do that through a point in time count or data work group. A lot of times we'll see communities really focused on HMIS participation. So that could be something that you kind of consolidate within the point in time count. And smaller communities, it might not make sense necessarily to have a year-round standing point in time count work group or committee. But we would really encourage LHCs to think about how you're able to kind of move the needle on some of those things, because it is going to impact the long-term prospects of funding in the community. And then in addition to work groups around data and point in time count, housing inventory count, making sure everyone's kind of doing their part, as it relates to that request of LHCs to demonstrate their support of a project application, like, do you have a funding work group? Is there a group of folks in your community that's focused on community level funding, not necessarily like my project or your project or, you know, this agency or that agency, but like really, you know, what do we need in a community and how do we get from where we are to where we would like to be? You know, Ava showed on the previous slide that that there's a huge gap in single adults with no children beds for that population in the Balance Estate. That may or may not be the case for your specific community, and that's where your local analysis comes in, but there is almost certainly some gap in your local system that could be addressed through more intentional planning. And so again, we would encourage you to incorporate that into a strategic plan if at all possible. And I feel like I know Jen is on this call and I don't want to step on Jen's toes. So if y'all have already been talking about strategic planning and Jen's told you something different like that, you know, whatever, go with what Jen is supporting y'all around. But from where I sit and where, you know, again, my team is kind of tasked with evaluating requests for funding, that's a really important part of the whole process. So Jen, I don't know if you have anything that you would add to the LHC kind of strategy conversation, or if I've just totally stepped on your toes, or if you have anything that you would kind of put forward.
No, I was kind of looking at the chat, so if I say something you've already said, I apologize. I'm not good at doing two things at once. But I think from what I did hear, I completely agree with what you're saying. And also when it comes to strategic plan, we do have some tools available, such as a local action plan, and it discusses a lot of what the COC does, and it helps you align your actions with the COC and what like HUD would look at. Is that helpful to that?
Yeah, thank you. And I think too, like if your local homeless coalition does not currently have a strategic plan and you're like, we're all volunteer, dude, we don't have the capacity to like get something like this off the ground. It can literally be something as simple as planning, you know, around the point in time count and the housing inventory count. And in fact, I think some of our template documents reflect that as kind of a goal and kind of give you some ideas about how to get started in that respect. So I recognize that we're asking y'all to spend straw into gold, right? Like a lot of local homeless coalitions do not have much capacity in the way of paid staff or anything like that, but we are here to support and help out however we can. So I'm also now looking at the chat and I see that you put the local action plan template in the chat, Jen. But you know, it's not like there's no magic formula, right? Like a lot of it really boils down to looking at what you got, looking at what you don't have, and determining like where the gaps are, and then planning something around the gaps. So with that, Ava, I would turn it back over to you. If there are any specific questions for me, like you can put them in the chat, and I will do my best to answer them in this space. And if I can't answer them right here, we'll get you some written follow-up.
Yeah, for sure. Yeah, we were just about to like hold some space for question time. Because I know that was a lot of information, and sometimes this can be like a little bit challenging to understand. So we just wanted to like hold some space for y'all. So feel free to like type your questions in the chat, come off mute, whatever you feel like doing. And you know, if we don't have an answer for you now, we can definitely get back to you.
I did want to go back to one of the things that I had said about, you know, LHCs demonstrating support of individual project applications in your community or in your local homeless coalition kind of service area. So that's something that applicants will initiate with the LHC. You don't necessarily need to worry about like, oh, well, I don't know who's going to apply this year or whatever, or if anyone will apply. if someone is applying, they should be reaching out to their local homeless coalition chair to start that conversation. And I think, again, it is up to y'all what that conversation looks like. And we would encourage you to really, you know, you don't want to like press people for things, but definitely using it as like an inflection point for some more intentional conversations is kind of the goal with that requirement for applicants. So I can answer some questions about that if there are any, or anything else that folks might have. Or I know Ava does a really good job of presenting the data thoroughly. Ava, do we have anything like what you shared towards the end of your slide deck on the local level, like by PIT region?
Yeah, I know we used to put together infographics individualized for each region. If you're interested in like something like that, please let me know and I can put that together. We do have individualized PIT reports for each LHC, each region as well. So if you're needing those, my contact information, we're gonna go over that at the end.
Okay, and I see that Rhoda has her hand up.
Yeah, please come off mute.
Hello, can y'all hear me?
Yes.
Y'all can hear me? Okay. I
Sure
just
can.
wasn't for sure. This is my first day back since Thursday, so I'm running and gunning, but thank you all for sharing so much information. Ava, I know I kind of came in late, but I was gravitating to and listening to a lot of things you were saying. So thank y'all for holding and giving up your time and information. So I sit on a board here in the East Texas area. I also work for a doctor's office for adults that are on Medicare. And so I've been able to really do a lot of work with nonprofits, veterans, you know, which I know is a whole different playing field. But so my question to Mr. Jim was, so when you're saying funding, like for any events, because I know that most nonprofits do their own kind of funding. And the nonprofit that I sit on the board for is the Northeast Texas Homeless Consortium. So my question is, I know that pre-COVID, this has been a nonprofit that's kind of been, you know, doing some legwork, boots on the ground, that type of stuff. And so when I came in in February, at the beginning of this year, I was wanting to bring new ideas for fundraising, like a masquerade, you know, fall fest, or, you know, just anything that we can do to help kind of facilitate those people, because working with the doctor's office as an outreach executive, also, I'm always in the playing field. I'm always out there doing the, you know, the boots on the ground work with, you know, soup kitchens, you know, food pantries, whatever it is. So I'm always in connection with people that are either living in their car or, you know, living in a tent behind somebody's house that has allowed them. And that guy was a veteran. So my question is, how do we go about really facilitating fundraisers to help the nonprofits in all areas? I'm guessing that's what you guys were talking about as well.
Yeah, well, that's actually, I'm glad you raised your hand to ask the question. So I think what we see and what we're kind of most familiar with are federal and state funding. So not necessarily the type of individualized.
Is anyone talking?
Oh, I'm sorry. Yeah, I'm talking. Can you hear?
No, I can hear you now. Sorry, I was hearing crickets. I was like, what happened? Did I scare everyone?
No, not at all. I was just saying, thank you for your question. I think what I'm talking about and kind of what I'm most familiar with are federal and state funding opportunities for housing and services. So not so much like that infrastructure funding that it sounds like you're talking about, like how do we get this nonprofit from where they're at to like the next, you know, quote unquote, the next level. So that's a little bit of a different conversation. And, you know, it's honestly pretty individualized by the community in the region. Like there are tons of private philanthropic foundations that might serve a single county or a cluster of counties. Like I know in Galveston, like there's the Methodist, Hospital Foundation the permanent endowment fund. There are different things based on the community. And I think what I'm talking about right now is if you're working with an organization who wants to access federal funding or state funding, which I know not everyone does. And so I'll just be upfront about that. Like that's a very real thing. And many nonprofits don't want to have anything to do with the feds or with the state government in that respect. Those funders will ask about the need for the project and how you determine the need for the project. And so I think what we were hoping today to kind of communicate to LHC leaders is like how to leverage the work that y'all did around the point in time count and have that work towards housing and services for people experiencing homelessness that you identified in that point in time count. So not so much like fundraisers, although I think like, you know, nonprofit, I'm on the board of a nonprofit here locally, and that's like I feel like that's the only thing we talk about sometimes is like, how do we get more money for the mission? That is such an individualized thing that it would be hard to kind of speak to it, I think, in this setting. But it will also depend on like what they're seeking funding for, right? Like if they're seeking like operational support for, you know, a broader like administrative backbone to you know, start accessing federal funds, that's a very different ask than like you know, a matching grant from a local foundation to provide rental assistance and security deposits. So that's certainly something that we can talk more about. Jen, I don't know if you have any thoughts too about, you know, what you're seeing with some LHC, or what you are seeing LHCs have success with as it relates to that.
Yeah, I will say like LHCs that are able to get local government involved in funding like housing interventions or service interventions have been more successful and going on to obtain like federal and state and like larger funding. One way you can do that with the local government is doing like a cost analysis. There was one coalition I helped do a cost analysis with. Basically, there's a few studies that demonstrate that investing in housing and service interventions saves public dollars because those folks that receive housing and service interventions are less likely to use emergency services. So for example, there was one study that said that the annual average savings in like 2010 Chicago dollars per person for unhoused persons reporting having a chronic medical illness was $6,307 per person. And so we translated those 2010 Chicago dollars to 2023 San Marcos dollars and found that so 43 people in Hayes County were counted as having being unhoused and having a chronic medical illness. So theoretically, if they locally invested more in housing and service interventions in the long term, they could have an estimated total annual average savings of $307,000 per year. So that, I feel like that was a lot of information to be thrown at folks. But if you think that your local government, especially even local hospitals, a lot of hospitals across the country are starting to, and insurers actually, are starting to partner with housing programs because they're finding it's saving the hospital, especially public hospitals, money, and private hospitals as well, money, because then they don't have to foot the bill for those unhoused folks that cannot pay for their medical chronic illness, whatever medical bills that they accumulate, and like the emergency services that they use, they can't pay for that. So going to local hospitals and using your like point in time count data to kind of calculate a possible like annual average savings for the hospital could make a good case for the hospital partnering with them to create some sort of program. Yeah. Any questions about that? And I can put my information in the chat. We're also going to talk about how to do that specifically at a upcoming local homeless coalition work group. So if anybody's interested in like learning more about how to do that specifically, and then like actually do it to calculate it using your point in time count data, you can reach out to me and I'll get you on that, registered for that.
Hey, Jen, I know you and I haven't talked about this, but that sounds like something that really similar to what they're doing in the West Virginia balance estate. They're bringing managed care organizations or insurers into the mix and getting insurers kind of bought into the idea that housing is healthcare. And if you can, because I think what we see, right, is unsheltered folks typically lean really hard on emergency services. And so if you can decrease those emergency services cost to the insurer, you know, whether that's Medicaid or some other private insurer, it translates into a real cost savings for them. And so I'd love to connect you with Zach from West Virginia, and you can talk about what they're doing, because I think they found a partner that is willing to, you know, invest in the affordable housing development that is necessary. One of the things that the COC program is good about is providing, like, you know, tenant level rental assistance. It's not a great fit for like housing development, right? It's not a bricks and sticks kind of a fund. It's more of like an operational kind of a fund. So tenant-based rental assistance or other, you know, client level interventions. But really getting creative and bringing other folks to the table that have a vested interest in decreasing the cost associated with unsheltered homelessness is a really good way to look at the issue. Another one that I'm seeing, and this also comes out of San Marcos, is bringing their mental health court administrators to the table, right? Because often they'll see there's also a huge overlap with law enforcement and people sitting in county jails waiting for trials for low-level crimes that may not, you know, are just kind of gumming up the judicial process for the county. And so really looking at ways that you can avoid and bring in strategies to get people, one, out of jail, but really pre-arrest diversion into services that will prevent them from entering the carceral system is something that San Marcos is currently working on, or Hays County is working on, and seems like they're having some success. I'm not sure if Nancy or Josh are on here, but that's another kind of, you know, and you can use your point in time count data to demonstrate the overlap there, right? If there's a lack of awareness about the kind of overlap between mental health and homelessness, I think that the point in time count data can be really helpful to even demonstrate to your local county what the cost savings might be to implement something like a mental health court or some type of mental health diversion program. That's a lot. Again, we recognize that we're trying to spin straw into gold here, y'all. And so, you know, don't feel like you have to go at it alone. Jen literally talks about this stuff all day. I can also talk with you about, you know, what a strategy might be. You know, you are the expert in who you need in your community at the table, but certainly talk about what other communities have done with success, and how to leverage the data that you do have into something that's more than what you have now.
Hi, this is Jim in Lubbock. I'm interested in how you characterize the 1,239 children that were identified. Are they identified through the school districts? Are they part of families? How do they get into the PIT count?
Yeah, the 1,239. Let me go back to this slide real quick.
That's a great question.
So the statistic right here. So these are not actually identified through the school district. When we conduct these surveys, we ask a question regarding their age, and if they say that they are under the age of 18, they're categorized as children. Does that make sense?
Okay. But are these children that are in shelters, or where are these children when they're counted?
So in this particular statistic, the 1,239 people that we counted as children, this number is like a combined total of both the sheltered and unsheltered. In our PIT reports, we give a breakdown of different household types, whether they are sheltered, unsheltered, families, or even like the statistic we mentioned earlier in the housing inventory count, houses with only children. This is broken down, but in that particular statistic, it's combined.
So do you find that most of that's coming then obviously from the households with children, and it will depend on the community whether or not those are folks coming from emergency shelter or transitional housing, where they're living in their vehicle or some other non-habitable situation.
Well, some of the new correspondence that I've seen out of HUD indicates that children are becoming one of the more important areas of emphasis. But we have probably, I think the last number I heard was 666 children in Lubbock Independent School District that are not included in the PIT count in any way that I know of. Is there a reason why children in school are not included? Is that an exclusion, or what's the issue there?
Yeah, so HUD has a very particular definition of homelessness, to where some folks might be excluded in certain cases if they are kind of like what you would call couch surfing, or maybe they're staying with a friend or with a family member. Under HUD's definition, we couldn't count those people because they would technically be considered housed, or maybe like housing insecure, if that makes sense. Have you heard that term before, housing insecure?
Yes, sure.
Yeah, like that is not under HUD's definition of homelessness. So those 600 plus people might not have fit that particular definition, if that makes sense. When we
I
were
think
through this count.
I think it kind of all boils down to a mismatch in how school districts identify youth experiencing homelessness and how other McKinney-Vento programs identify people experiencing homelessness. For the point in time count, there's a really specific definitions, and for the school district, they do count youth that are couch surfing or doubled up. And so it could be that, some of those youth that are reflected in this 1,239 statistic, and I don't know about Lubbock specifically, it could be that some of those youth are being counted here, but it's quite likely that there are numerous youth that are identified by your school district as experiencing homelessness that are not reflected in the point in time count, which you've obviously picked up on.
So, excuse me. So we're assuming that, sorry, my voice is not good. We're assuming that if they're identified by the school district, they are couch surfing and are therefore not qualified, but we don't do any interviews to see whether that's the case or not, whether they could be living in a car someplace. Is that kind of the assumption that goes into the PIT count?
To jump in here.
Okay,
Sorry. Hello, I'm Kira Henderson. I'm Ava's supervisor, but I also was previously in this role, and I know that this question comes up every year. So essentially, we don't make any assumptions on that part. Really, where it comes down to is school districts have their own separate data set, right? That is inclusive of all of those folks that fall under their definition. When it comes to the point in time count planning, they are invited and encouraged to join in count planning efforts, but there's a couple stipulations with that. Number one, the school district is not allowed to, or school district staff, they're not allowed to conduct surveys during school hours on school property because it violates some of their grant agreements within their roles. So those staff are not able to conduct those surveys at school on the day of the point in time count. And they also have to get in contact with the parents in order to conduct the surveys on kiddos outside of school hours. So we don't make any assumptions on that part. We really ask them to be a part of the planning process. And then if they are aware of clients that are students and families that are staying in an unsheltered location or in a sheltered program, they are then asked to help kind of bridge that gap and help those folks be identified. So does that help better clarify it?
Yeah,
Essentially, we don't ever intentionally exclude them.
Yeah, it does, but that doesn't mean, I assume that doesn't mean that the local homeless consortium couldn't interview those kids if they were, if they wanted to include them in the PIT count?
Correct. So if outside of school hours, they were able to contact the parents and be able to meet up with them to conduct the surveys, that is completely allowed. It's just that piece of during school hours and making sure that you're getting the parent or guardian's consent.
Yeah, no, well, I understand about the school staff, but I'm asking about the homeless consortium, the local homeless consortium. Could we seek out those parents to interview them?
Yes, absolutely. Again, that I was just referencing specifically, like we don't want people from the homeless consortium showing up to school on the day of the point in time count and conducting
Oh,
these surveys.
okay, okay.
That
I see.
we still want to make sure that we're not disrupting their day, that we're getting the consent possible. And so working with your school district to see, okay, what is the best way for us to be able to have these surveys conducted? They are more than welcome to conduct or help support count efforts outside of hours as well. So if the school district staff wanted to be the ones to count their students, they could, as long as it's not on school grounds.
Mhm.
Okay.
And it's kind of volunteer time.
Another curveball to all this situation with ISDs versus HUD definition is at the beginning of the school year, the ISD will do the student residency questionnaire. So at the beginning of the school district, they'll know what the housing placement of that child was. Now, McKinney-Vento changes. If they find, say, right halfway through the year, housing displacement occurs, they're still either protected from the beginning of the year when they identified they were housing displaced, or at the beginning or the middle of the year. So it's not matching up. When we do the point in time count, they've asked them back in September when they started, we're asking their living situation in January. So those two data points don't match up. So you would have to do the same interview at the same time we're doing the point in time count to the kids in the ISD. On top of that, it does call into account of privacy. You have to get the parents' consent to ask these children these questions. So there's a lot of moving pieces because we've tried this in the past when I was the Homeless Coalition liaison, matching HUD data versus McKinney-Vento data, because there's no way to de-identify to say, did this parent answer both questions at the same time? Did this household get surveyed at the school and not in PIT? Did they get PIT not in school? So it became two different data sets that wouldn't match. So you had to look at them at two separate piles of data, right? So it just gets very hairy when you're looking at McKinney-Vento data versus HUD. And then Jessica isn't required to update. Yes, they would have to refill their residency questionnaire out, but if that's the school's responsibility. Now, if they're working with a case manager for another service provider, they would have access to that data too. But yeah, every time the housing situation changes with a child, that residency should be updated with the school immediately. Exactly, Elena. Yes, yes. So say they left Lubbock ISD and went to Post ISD. Lubbock says they were displaced ISD. They don't change that. Post over here now has another one. So they've ticked off another mark saying we have another displaced family because they didn't update Lubbock and Post at the same time. So there does become this duplication of data as families are displaced and moved around too.
Hey, Jen, are you aware of any local homeless coalition that is really done a great job in terms of like engaging their ISD? I know Bastrop, like the Norma is the chair of the Bastrop Homeless Coalition, and she's the homeless education liaison. But in terms of like other communities that could act as like a peer guide for this purpose, because I think, and it was Jim, I believe, Jim brings up a really good point in terms of how do we ensure that we're not unintentionally excluding youth where we're able to count them?
Yeah, good question. There are actually a lot of local homeless coalitions that do a really good job of engaging their local or their homeless education liaisons or McKinney-Vento liaisons. I'm going to single out Brazoria County because they actually started as working, like I think it was the United Way, coordinating meetings with started with just homeless education liaisons in the area and then grew into a full-fledged local homeless coalition. So they have a lot of really good advice on how to engage homeless coalitions. I mean, the McKinney-Vento liaisons and connecting them with folks. But there are a lot of really good coalitions that are doing that work.
Yeah, we also had someone ask, you know, does that mean that those individuals aren't able to get the help that they need, even though they don't have a real home to call their own? Not necessarily, like they can still get help. It's just because like HUD has a very rigid definition of homelessness, and in our work with the point in time count, we have to adhere to their methodology when reporting this. So an independent school district's methodology might be different than our methodology for the point in time count. Hopefully that makes sense.
And I think just to kind of take that a step further, each funder is going to have a specific definition of homeless that they're using for that funding opportunity. And that definition can change within the same program from year to year. So, right, like it's entirely possible with like the continuum of care program that HUD would slip the McKinney-Vento definition into the definition of homeless that they use for participant eligibility for a project year. And that could be found through the application documents for the relevant competition. And I know that it's the same way with the other kind of big federal program, which is the Emergency Solutions Grant Program. Some of the folks on this call may be in a community that gets those funds directly from HUD, but others are in the non-entitlement jurisdictions that are governed by the Texas Department of Housing and Community Affairs. I think this is definitely something that HUD is starting to wake up to in terms of the discrepancy between the McKinney-Vento and Hearth Act definitions. Great questions.
I just realized I was muted. My bad. So we have about 5 minutes left. Do we have any other last questions?
There's a question in the chat about who is named for Bastrop ISD, and I may have misspoken. Norma Mercado is the homeless education liaison, and I'm not sure if she's still the chair of the coalition, but she is Jen, can you speak more to that?
Yeah, Ethel, I'm forgetting her last name. Ethel Ellis is the new contact for the Colorado Valley Homeless Coalition. And I would want to reach out to her before listing her as a contact because she just took over as the lead. So I'd want to like touch base with her before sharing her contact information to talk about this, but I can do that. But another coalition lead that started the meetings with homeless education liaisons in Park County. Hold on one second. Yeah,
Jim, and I think relevant to you while Jen's looking for that, I think it looks like Tamara posted in the chat that the Lubbock ISD homeless education liaison is in the chat.
Yeah. Yeah, and Gloria Luna with Homeless Coalition of Brazoria County and the United Way is the one who started those meetings with just the United Way and the homeless education liaisons. So if you're interested in speaking with her too, but yeah, there are so many coalitions that are amazing about connecting with their homeless education liaisons.
Yeah, 100%. We got about 3 minutes left. I want to quickly just point out some of these resources. We're going to be sending this PowerPoint out to y'all, so y'all can have it available to you and access these links. On here, we have a link for nonprofit strategic planning, a link to our How to Read Your PIT Data webinar. I'm going to have our contact information at the very end. So if you are needing that PIT data, please contact me. And we also have this webinar here that can help guide you through those PIT reports and guide you through that data. And then we have a link to the PIT reports themselves on our THN website, and a COC program intro webinar. So with all that being said, we just want to thank y'all for coming out today and chatting through some of this information with us. We know it is a lot to take in, obviously. So please feel free to email us or call us at our information on here. I have 2 emails for myself. I have the data email and then my personal email. I wanted to just mention quickly, like if you are needing reports for your LHC, please contact the data email, data@thn.org. But if you're needing more specialized reports or analysis, please feel free to contact me at ava@thn.org, and I will get back to you. And Jim's email is there as well. Well, yeah, thank you. Thank you all for joining us.
Yeah, thanks so much for the work y'all do every day in your community. We really, really can't do what we're doing without you. And you know, as Ava said it already. If you have any questions for me specifically, please feel free to reach out.
Yeah, any questions regarding this webinar, ava@thn.org or jim@thn.org. All righty.
Thanks, everyone.